Good evening all. I'm Aditi Lama with the Thursday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin by taking a look at the coronavirus pandemic and its impact. The world has surpassed 125 million cases of COVID-19 with nearly 3 million deaths. Here in the United States, we are at more than 545,000 COVID-19 deaths with now more than 30 million cases. The CDC is now worrying about a potential new surge as cases continue to rise in parts of the Northeast and the Upper Midwest. On vaccines, states are increasing eligibility to their residents and are encouraging all to get the vaccine when it's their time. Also on vaccine, about 2.5 million Americans are being vaccinated each day, according to the White House, and about 18% of the U.S. adult population is completely vaccinated. Meanwhile, on the very sad case of the shootings, both in Boulder, Colorado and Atlanta, Georgia, President Joe Biden is pushing for a pair of House-passed gun reforms, including universal background checks and an assault weapons ban. These shootings have sparked calls for racial justice and gun legislation across the nation. On this and the COVID-19 updates, we have tonight political leaders, activists and medical professionals. Here are the headlines. Launch of Asian Pacific American Voice Redistricting Task Force, Queens, New York City. GOPIO hosts webinar on current and post-COVID, getting back to normal business and Indian American perspective, Connecticut. Experts worry about another surge of COVID-19 cases featuring Dr. Bindu Balani, Hackensack University Medical Center, New Jersey. It's time for a show become Vision of Asia South Asian News segment. We'll be right back. Welcome back. I am Aditi Lama and this is Vision of Asia, Thursday night episode of South Asian News. Let's take a look at coronavirus updates and measures. Top health experts in the CDC have said that they worry of a possible fourth surge of the coronavirus in the United States. They have said not enough Americans are fully vaccinated yet to suppress the spread of the virus, and eased restrictions in many states, including end of mask mandates, have caused an uptick in cases of COVID-19. The CDC also said that they are concerned about people who are not continuing to implement strategies while we fully scale up. Meanwhile, on vaccines, more than 162 million doses have been distributed, with 130 administered. AstraZeneca has updated its information on COVID-19 clinical trial of its vaccine, showing an efficacy of 76% instead of 79%, which it had claimed earlier this week. This is happening as the company awaits approval in the US and hopes to be the fourth vaccine to speed up the vaccination process. On this and much more, we spoke with infectious disease expert Dr. Bindu Balani. Here is Dr. Balani. We are looking at more than 30 million cases of COVID-19 in this country, with at least 545,000 deaths. My question to you is, how are you observing these numbers currently? And, CDC Director Dr. Walensky said that, the cases are increasing in the Northeast and the Upper Midwest. What are your comments on this?
So, since, I guess, mid-February, we have at about nearly 2,000 patients in our health systems. So it's a pretty significant number, just like what we had in November. So the numbers, there was a slight uptake in the numbers in the last week. This week is slightly bit better. But overall, we were a little concerned that obviously the numbers going up, and especially with the news about the different variants in New York and Northeast area, it's a little concerning at this point.
Right. And doctor, because of these variants, many European nations are going under the lockdown, even though they're trying to vaccinate their people. What will need to happen in this country for us to go into a lockdown with these variants?
I hope it doesn't.
Yeah.
I hope we don't have to do that particular lockdown or that effect of the lockdown. But again, if we see a rise in the number of cases over a period of time, I think that would be something that would cause the concern of the possibilities of a need for lockdown. At the current time, though, we don't see it being in the near future, and I hope that's correct. The vaccination efforts have been phenomenal. So we hope that we are going to be doing this catch up between the vaccination and the variants coming along or the new cases coming along. So hopefully we don't have to go back into the lockdown area.
And when you are looking at these cases, Dr. Balani, my question to you is, who do you think are the biggest contributors right now? And how much did spring break affect this uptick of cases?
It's hard to say. Of course, people are getting a little tired of doing their social distancings, etc. So especially with the spring break, both the ones in the last week as well as the upcoming weeks, I think it's very important that the young kids and the young adults are aware of still the various factors that they need to use to mitigate this particular spread. These are the patients, these are the people who have not yet taken or not yet received their vaccinations because obviously the age cutoff has not met there yet. So I think it's still very, very important that we continue to pursue with our, the whole point of social distancing and masking, etc. And the spring break, as you said, people are trying to party and that's not going to be helpful.
Yes. And just looking at that, doctor, there are certain states that are currently loosening restrictions, including ending their mask mandate, as we were just talking about these 3 key guidelines. Do you think it's a wise decision to do so right now?
Not so right now, not so in the summer, not so in the fall. I don't think we should be letting our guards down at this point, because if we are to be a success in this particular pandemic, I think with the vaccinations on board, but social distancing and masking, etc., needs to continue, both because one, not everybody is going to be vaccinated at all given times, and number two, not every person who gets vaccine may be lucky enough to be in that 95 or 100% rates. So I think we do need to take it with caution. We do need to take these vaccines with a caution. I think the vaccines are fantastic, and I think everybody should step forward and take it. But leaving our social distancing and leaving our masks at home is just going to not be able to catch up that particular deficit that's required to keep this pandemic at bay.
Just to follow up with that, doctor, do you see us wearing masks up until perhaps 2022?
I think so.
Right. Well, as long as we all continue to follow this, just more talking about states and loosening restrictions. New York City, where we all are situated, the mayor, Mr. Bill de Blasio, has said that he wants to end remote working by May 3rd. He wants people to go back into work in person. My question to you is, with the variant spreading and us still not meeting that vaccine, administration to the full capacity, is it wise to open a city like New York City, which was once the epicenter?
I think it all depends. I'm sure that the mayor is getting good information regarding the vaccine rollouts and the ability to vaccine by that particular date that he has set forward. Everything is fluid. Everything is assessed on a day-to-day basis. So we hope that we can go back to some form of normalcy, and hopefully sooner rather than later. But again, I think it's an evolution in process. We just need to kind of wait and see. It's a great deadline, but I'm not sure that it maybe as practically feasible.
Yeah, only time will tell. Maybe we'll be vaccinated enough for them to open. That would be such a great news. Let's talk a little bit more about vaccines, doctor. Right now, when you're looking at the vaccination program, which is, they're trying to ramp it up, do you think we are vaccinating at a higher rate and a more effective rate? What do you think is maybe missing still in this whole process?
No, I think the vaccination rate has been phenomenal. And with the help of the National Guards, with the police departments, with the state departments, etc., all working together hand in hand, these mega sites are just fabulous. The number of cases, the number of subjects that have been vaccinated, the number of the population that has been vaccinated has been very, very high numbers. And they continue to rise. And as the days goes on, the efficacy and the flow has been getting better and better. I think getting the vaccines to each and every section that should be getting from 18 and above, actually 16 and above in the case of Pfizer. So 16 and above should be rolled out faster, maybe different time frames, like how we had the Teachers' Day, like maybe some weekends for those who are essential workers who are not able to make it during the day, school days, etc. So having those kind of programs, having mobile units, I've heard about some state departments kind of rolling out on a mobile unit to try and still catch up and do the rehabs and long-term facilities, etc., to be able to revaccinate the people that they would not be able to vaccinate the first time in January or February. So all these catch-up programs that are currently present, I think, will just help in increasing the number of cases to be vaccinated. And of course, having a vaccine which is just a one dose really is very helpful, because now we are able to vaccinate even people coming into the ED and going back home, or patients leaving from the hospital going back home. We're able to vaccinate with the Johnson vaccine at that particular time. So again, people where you may be concerned about their ability to come back for a second vaccine, somebody from the shelter, somebody homeless, all of those people, that population can now be nicely brought into the system of vaccination by getting them the one dose vaccine.
Right.
So
and
everything is working out in the right direction.
Let's now take a look at the Global Organization of People of Indian Origin, GOPIO's chapter in Connecticut. The organization is a part of a worldwide movement dedicated to community service and working with people to coordinate activities of common interest nationally and on a global scale. GOPIO serves as a civic and community service organization promoting awareness of Indian culture, its people, and contributions of the Indian American community and its importance. On that, recently, GOPIO Connecticut held a webinar titled Current and Post-COVID, Getting Back to Normal Businesses and Indian American Perspective. The interactive session focused on bringing small businesses owned by Indian Americans back to a sense of normalcy while they recover from the economic ramifications of this pandemic. A very informative session with perspectives from Indian American business owners and professional practitioners. Here is the story.
Good evening. I am Thomas Abraham, Chairman of the Global Organization of People of Indian Origin and Trustee and Chair of Seminar Series at GOPIO, Connecticut. Honorable members of Connecticut Legislative Assembly, Speaker Matt Ritter, Minority Leader Vincent Candelora, Representative Harry Arora, Representative Regib Ali Brennan, and moderator and past representative Dr. Prasad Srinivasan. On behalf of GOPIO Connecticut and its President Ashok Nichani and Milan Cultural Association President Suresh Sharma, I welcome you to this interactive meeting with the community. Although the pandemic kept us homebound for about 1 year, this has also provided an opportunity for us to reach out our legislators through Zoom. 2 weeks back, President Biden called up Dr. Swati Mohan, lead of control and guidance for NASA's rover Perseverance, for its successful landing on the Mars. He said to Dr. Mohan that Indian Americans are taking over America. We all know that that is not a true statement, but the spirit at which he made that statement is greatly appreciated by our community. So for our interactive session this evening, we are not here to demand any special benefits for our community, but explore how, with our experience in business and professional practice, we can help Connecticut State to come back to normal business sooner. So we have put together a webinar session titled Current and Post-COVID Getting Back to Normal Business and Indian American Perspective in Connecticut with our community.
We're all hopeful that we're very close to the end of this thing. We're hopeful the vaccines work or that we have boosters available in quick fashion and short order for the strains. But on a personal note, I want to thank all of you for your commitment to our state, for your contributions to our business community, to making our state the diverse, wonderful place that it is. And I can just tell you that there are few people who did a lot for me in my 2 years as public health, or who did more for me than Prasad Srinivasan. And that might seem odd because he's a Republican and I'm a Democrat. But our ability to manage that committee in a manner that fostered respect, collegiality, and bipartisanship was a model. And when I was done chairing that committee, I was elected to leadership at 34 years old. And Prasad played a role in helping me get there. I'll always be appreciative of his friendship, his support. And when he couldn't get there, he couldn't get there. But we tried very hard to make it work. And I'm glad to take any questions. And I thank you for having me tonight.
This is the first time, I think, in Connecticut, we have this Indian American community with this forum to address this getting back to normal business. And I really thank Dr. Thomas for organizing this. I think this is an amazing group of people here from various industries sharing their experiences. I'm Ramya Subramanian, and I'm honored to be here. I'm president, founder, co-founder of 3 Connecticut-based companies. Arca Information Systems, which is an IT services company, and we have offices in India and the US. DocT, which is a telemedicine platform with offices in 3 continents, South America, South Africa, and India. And Bridgeport Labs, which is a minority nonprofit enterprise. Interestingly, everyone's talking about what they went through in 2020. The 2 of the 3 companies that I am president and founder and co-founder of was started in 2020, which is DocT and Bridgeport Labs. Though for DocT, we've been, in the works and research and all of those fun stuff for over 2 years, and Bridgeport Labs for over 6 years. So we did, start up those companies in 2020, which is interesting considering, what we've been through. So I'm really going to talk about, though everyone's spoken about their experiences this past year, my focus is going to be on the present. And I think we have accepted this new normal. The safety measures are in place at the offices. Masks are a given. People are very mindful about being safe. And I think we've been bringing our employees back to the office in an incremental fashion, making sure that, everyone is, safe and distant. And all our office spaces has been reconfigured to make sure that we're compliant with all of the safety norms. And our state, and I think the country in the whole, has catered to all of this in a very effective manner, which has helped, people like us, bring this in an effective manner as well. Our companies has been, all of our companies are in different industries and in different countries. And I felt this past year, our productivity was really high, across the different time zones and the different countries. We could feel that people were really working more and sitting at home during the time they were at home. And I think we had to think about, employee mental state, which was more critical. That's what we were, keeping in mind during the time that they were there at home. Now, what do you think we should do now more than ever on an innovation point of view? I was starting to think about that. And what COVID really taught us more than anything is to stay healthy, be healthy, continue to be healthy for everyone around us. And 3 words came to my mind when I was thinking about the future. And that was clean energy infrastructure. Not only does I feel that this ties with a cleaner planet for generations to come, from the point of building the economy back in our state post-COVID, I think clean energy legislation was something that I feel will help create this to be adopted by all. And I think this in turn will encourage and promote employment opportunities through workforce development. What we need post-COVID, I feel, in short, is workforce development and job creation. It made me think about questions like, how can the state help with this? How can the state help businesses with this? How can businesses in turn help the state? I don't think we really need to, reinvent the wheel. It's right there in front of us. I think we just need to rediscover what these new outcomes are. If anything that has come out of COVID, it's new partnerships, new relationships that we did not have before. And I think this can be absolutely discovered through solutions, technology, innovations, and partnership. I think that's in short that I wanted to share about what 2020 had for me in the various industries and what it holds in the future.
And welcome back. I am Diti Lama, and this is Vision of Asia South Asian News segment. In politics and more, let's now take a look at APA Voice, the Asian Pacific Americans voting and organizing to increase civic engagement. It is a non-partisan, pan-Asian collaborations of organizations and individuals seeking to increase awareness on civic engagement in the Asian American community. On that, recently in Queens, New York City, APA Voice launched its Redistricting Task Force. Congressional and state lines are redrawn every 10 years based on the census. On that, this task force consists of 14 leading Asian Pacific American groups to ensure fair and equal access to power and the representation for the 14% of Asian Americans in New York City. This task force will also work on ensuring access to resources for Asian Americans in healthcare, education, transportation, jobs, housing, and public safety. Focused on more Asian American visibility, we have highlights from this launch. Here is the story.
Founded in 1976, our chapter is a New York affiliate of OCA, Asian Pacific American Advocates, a national civil rights organization dedicated to advancing the social, political, and economic well-being of Asian Pacific Americans in the United States. Last year, our chapter was involved in the APA Voice Census Complete Count workshops, co-sponsored candidate forums in Queens, and led a community hate crime prevention project with a diverse cohort of youth across the city. Our chapter has also engaged the broader APA community in several voter education events, voter registration drives, and testified in front of City Council regarding language access. Since civic participation is one of our chapter's founding goals, we believe public involvement in redistricting is critical for ensuring that our voices of all ages are heard in the map drawing process. Our chapter was a founding member of Accord in the 2010 redistricting cycle. I wasn't here, I was still in middle school, but I applaud you all for your amazing work. Thank you for paving the way. But now, during a time of political awakening of many young people in our community, we have an opportunity to educate and mobilize the next generation of Asian American leaders in our community. We have an opportunity to let them know that what we do today, or rather what we draw now, will impact our future for the next 10 years. That is why I am so excited to announce the task force's educational digital campaign, #OurVoiceOurMaps.
So funding the Independent Redistrict Commission is the key to ensure our communities will have a fair and accurate redistricting process. The commission would draw new district lines for the New York State Assembly, the State Senate, and the House of Representatives. And when the maps are drawn incorrectly, we know districts can be easily gerrymandered by partisan actors, whether they're Democrats or they're Republicans or by money interest. So it is important that we do fund the Independent Redistricting Commission, and they need at least $4 million. And yet the Independent Redistricting Commission has to receive the $1 million to even begin doing their work. So we ask that the governor and the state legislature to fully fund the Redistricting Commission as quickly as possible to make sure that this important work gets done right now. We are requesting to meet with the commissioners, and we'll also be testifying in the 5 boroughs to ensure that our communities do not get split up and they stay together. And we have representatives that represents all our interests.
Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.